Good day. We are the group 4 and we will be discussing about the endocrine drugs. The content outline. The first one is the thyroid and then anti-thyroid, steroids, and anti-diabetic drugs.
Now, I am going to discuss the endocrine medication. First is the thyroid. So, I am going to discuss the generic name and the brand name of the chosen medications. So, first is um, Liotrix, and its brand name is Thyrolar. Next is, or number 2 is levothyroxine, and its brand name is Levoxel. Third is the liothyronine, and its brand name is Trialstar. So now I am going to discuss the mechanism of action of the thyroid. So first, it increases the heart rate, cardiac contractility, and cardiac output. So it also has a synthetic crystalline levothyroxine sodium that the thyroid gland secreted. So which means that this hormone regulates the metabolic rate of the body tissues. So next, I am going to discuss about the major side effects of thyroid. First, it has an effect of nausea and vomiting. The next adverse effect is it has a sign of increased metabolism, tachycardia, hypertension, cardiac arrhythmias, anxiety, headache, tremors, palpitations. So those are the major side effects of thyroid. Next is I am going to discuss the nursing actions consideration and its rationale. So first we have here monitor weight and vital signs. So the rationale behind this is to obtain baseline data. Next, number 2, we have here instruct the client to take daily medication the same time each morning without food. So the rationale behind this is to ensure consistent therapeutic levels. Next, we have here monitor blood test to check the activity of thyroid, and its rationale is to monitor the effectiveness of the therapy and to ensure the correct levels of drug administered are maintained. Next, number 4, we have here advice to report palpitation, tachycardia, and chest pain. So, the rationale is to prevent further toxicity overdose. So, as I have mentioned earlier, it is a sign of an adverse effect. So, therefore, we need to watch these signs, for it may cause or it is a sign of drug toxicity or overdose. The last rationale, I mean nursing actions consideration, is to instruct to avoid foods that inhibit thyroid secretions like cabbage, spinach, and radishes. So the rationale behind this is cabbage, spinach, and radishes contains minerals that are rich in calcium, zinc, and magnesium, which interferes with absorption and effectiveness of the drug. So
Drug classification is antithyroid. Generic name is metamazole. Brand name is tapazole. Its mechanism of action is it inhibits synthesis of thyroid hormones and it interferes with the step that causes the iodination of tyrosine residues in thyroglobulin. Its major adverse effects of metamazole is nausea and vomiting, drowsiness, lethargy, bradycardia, skin rash. GI complaints, arthralgia, myalgia, most important to monitor for agranulocytosis. Its nursing responsibilities is to monitor vital signs T3 and T4, weight, and its rationale is it is crucial to monitor T3 and T4 levels in serum to adjust the dose to maintain euthyroid state. And next one is the medication with meals to reduce side effects of stomach irritation. Third one is to instruct to report sore throat or unexplained fever. To inform the patient that sore throat and fever is a rare side effect, and if it occurs, metamazole is told to stop the drug. The fourth one is to monitor for signs of hypothyroidism, which hypothyroidism can cause a variety of symptoms, such as fatigue, weight gain, and feeling cold. Lastly, instruct not to stop abrupt medication. Its rationale is because suddenly stopping the medication may worsen the condition.
Next is the steroids. Generic names and its brand names. Hydrocortisone, Cortef, prednisolone, Milipred, methylprednisolone, Medrol, and its mechanism of action. It helps reduce inflammation primarily by strengthening leukocyte lysosomal membranes. The adverse effects: hyperglycemia. The second one, increased susceptibility to infection, immunosuppression, hypokalemia, edema, peptic ulcer, and if high doses, osteoporosis, growth retardation, peptic ulcer, hypertension, cataract, mood changes, hirsutism, and fragile skin. The nursing actions. You need to monitor the VS, electrolytes, and the glucose. And its rationale is to determine baseline status before beginning therapy. The second one is to monitor weight, edema, and IO. The rationale for this is for the baseline data. The third one is to protect patient from infection. The rationale is that immune system may be suppressed due to steroids and patient is at increased risk of infection. The fourth one is to instruct to take meds with meals to stop irritating the stomach. Caution the patient not to abruptly stop the drug, to gradually take time for adrenal glands to return to their normal patterns of secretions. And the next, nursing actions. Drug is tapered. Evaluation: the drugs are effective if there is relief of signs and symptoms of inflammation, return of adrenal function to normal, to give chance to the adrenal glands to recover and be able to produce adrenocorticoids, and to avoid further complications to the other parts of the body. Hydrocortisone, Cortef, prednisolone, Milipred, methylprednisolone, Medrol. Nursing actions: monitor VS, T3 and T4, and the weight. The medications with meals, instruct to report sore throat or unexplained fever, monitor for signs of hypothyroidism, and instruct not to stop abrupt medication. Next is the anti-diabetic drugs. Insulin type. Ultra-acting. Example, Lespro. Onset 15 minutes. The peak is 1 hour. Rapid-acting. Regular insulin. 1 hour, 2 to 4 hours. Intermediate acting, the example NPH and Lente, onset for this is 1.5 to 2 hours, and the peak for this is 6 to 8 hours to 12 hours. And then the last one is the long acting. The example for this is the Ultra Lente, onset 4 to 8 hours, and the peak is 10 to 20 hours. The side effects of each insulin type. The first one is the ultra-acting. The side effects for this are dizziness, chills, blurred vision. The rapid-acting, nausea, confusion, tremor, and blurred vision. Intermediate-acting, sweating, dizziness, hunger, and fast heart rate. The last one is the long-acting, fainting, chills, weakness, and headache. The generic names and its brand names. Oral hypoglycemic agents. Glyburide, diabeta, glinase. Rosiglitazone, Avanja. Glipizide, glucotrol. And its mechanism of action. The first one is to increase insulin secretion from pancreatic B cells. The second one is to reduce insulin resistance. And then the last one, it increases the transcription of adipokines. The adverse effects, the first one is the risk of hypoglycemia, the weight gain, agranulocytosis, hemolysis, dark urine, headache, and diarrhea. Cardiac failure, increased risk of bone fractures or the osteoporosis, muscle pain, nausea, vomiting, and loss of appetite. So these are the adverse effects. And then the nursing actions.
Next is the nursing actions or implications for these oral hypoglycemic agents. First is observe for manifestations of hypoglycemia. We have mentioned earlier for this, too much insulin or other diabetes medications may cause your blood sugar level to drop too low, causing hypoglycemia. So you should monitor your patient or encourage your patient to follow their doctor's order or prescription. Next is to assess for allergic reactions. So it is a basic rule in nursing that before administering a medication to your patient, you should check or ask if the patient is allergic to the drug or they have certain allergic reactions. For this might cause anaphylaxis or may include a life-threatening condition that affects your multiple body systems. Next is to instruct to take the medication at the same time each day. So these oral hypoglycemic agents is considered to be a maintenance medication. So these maintenance medications are most effective if you take them around the same time every day. And it also helps you to remember to take them because it will make a habit out of you. Next is caution to avoid taking other drugs without consultation with physician. So you must stress this with your patients that this can result to a contraindication or a drug interaction that can be harmful for the patient. Next is these medications should not
or should never be given to pregnant women, so rule out pregnancy. Why? Because in late pregnancy, the hormones estrogen, cortisol, and human placental lactogen can block insulin. So when insulin is blocked, it's called insulin resistance, just like in type 2 diabetes mellitus. So glucose can't go into the body's cells. So, and the glucose stays in the blood and makes the blood sugar levels go up. So when it makes the medication useless, and it can also increase your blood glucose instead of lowering it down. So you should ask your doctor's advice for this before taking these kind of drugs. Next is to instruct your patient to wear sunscreen. Uh, One effects of not using sunscreen is sunburn, right? So sunburn can elevate blood glucose level. Next is to instruct your patient to wear sunscreen. One of the effects of not wearing sunscreen is sunburn. So sunburn can elevate blood glucose levels, or that certain diabetes medications can make them more susceptible to sunburn. Sunburn causes physical pain, and pain stresses the body. And when the body experiences stress, blood glucose levels tend to rise. And also to avoid your patients to have skin blisters, because diabetic patients have a slower healing process. Next is to advise to bring simple sugar to be taken when hypoglycemic episodes occur. So, as we all know, that glucose is the main source of fuel for the body and brain. So you can't function well if you don't have enough. You can rise your blood sugar quickly by eating or drinking a simple sugar source such as glucose tablets or fruit juice, which can neutralize your blood glucose level, because too much of everything is bad. Too high insulin level is bad, and too low insulin level or too low blood glucose level is also not good. So you need those fast-acting sugars or simple sugars to neutralize your blood glucose level. That's all. Another additional information is insulin, when not in use, should be stored in the refrigerator, but avoid freezing or extreme temperatures. Why? Insulin is a protein dissolved in liquids, so they could be possibly spoiled. So in order to refrain them from spoiling, it should be refrigerated. But avoid freezing or extreme temperatures, because when insulin is too cold, it is more painful to inject. So you should store it in a room temperature before administering it.